I want to take off my glasses, take off my lenses, but which surgery is the best for me and which clinic can help me choose it?
Hello, doctor.
Hello.
Doctor, I read on the internet that for lens implantation surgery, it's especially important to find a very skilled surgeon. Is that true?
Vision correction surgery doesn't usually depend that much on the surgeon's skill. Compared to LASIK or LASIK, smile surgery is known to be a bit more affected by the surgeon's technique. And ICL is even more so than smile. We call it an intraocular surgery because a lens is inserted inside the eye. It must be done without damaging other tissues like the lens, corneal endothelium, or iris. Since the likelihood of complications during surgery is a bit higher, it's fair to say that the outcome depends more heavily on the surgeon's technique. Experience is key.
When I hear about it, lens implantation sounds like it really depends on the surgeon's hands-on technique. So the surgeon's touch is very important, right? Then wouldn't machine-based surgeries like smile be considered more stable?
Well, you could say that, but recently there's a growing trend of preferring lens implantation over corneal surgeries when both are viable options. One major reason is that lens implantation is a reversible procedure. For example, even though it's rare, if after surgery you find things like visual discomfort or halos are worse than expected and you want to reverse it, then there's the advantage that your eyes can return to their original state. Including that, lens implantation has clear benefits compared to corneal surgeries. So in that sense, if performed safely by an experienced surgeon, lens implantation can actually offer more advantages and be a safer choice. It's not that one method is absolutely better than the other, but if you meet a surgeon who's good at what they do, like me, then the right way is to compare the results of each method and make a decision accordingly.
Well, lens implantation is ultimately a procedure performed by a human. Doesn't that mean there's a higher chance of complications?
If the surgeon is skilled, there shouldn't be many complications. But during the procedure, while inserting the lens, there is a possibility of damaging other intraocular structures. Those risks must be avoided, and for patients where that risk is too high, surgery should not even be planned in the first place. It's crucial to first select patients who are likely to have good outcomes. Inexperienced doctors may struggle to filter out patients who might end up with poor outcomes. Also, post-operative care requires patient cooperation. It's important to clearly explain how to care for the eyes and to conduct regular follow-ups. I think all three aspects must work well together. So it's not just about manual dexterity. Experience is key since every patient's eye structure and refractive error vary greatly. Being able to correctly identify who should not get the surgery, properly operate on those who should, and manage aftercare well. All of those elements must come together with a doctor who can align them well. I believe receiving surgery from such a doctor is important.
Are there any tips or advanced know-hows regarding toric ICLs that go beyond the usual concerns?
There are plenty. Honestly, I could go on forever. What surgeons struggled with in the early days of ICL was choosing the right lens size. Especially for astigmatism, it's about how precisely you target the correction amount and axis. That's critical. When I first started choosing ICL sizes back in 2002 while I was still at university, the method taught by the company was based on the white-to-white diameter, the corneal width, combined with anterior chamber depth and other parameters. You'd select the lens size based on the company's provided chart using those inputs, but in practice, that method led to sizing errors. So I started using something called UBM, ultrasound biomicroscopy. I documented my first lens sizing cases with UBM and submitted them to my university as a case report. I used that method for a while, but thankfully now we have more convenient tools like anterior segment, OCT. With the CAS IA2 device, the sizing process has become much more accurate and much easier than before. So I've used all the conventional methods: WTW-based sizing, UBM-based sizing, and anterior segment OCT. And since I've accumulated 25 years of experience with all of these methods, I'm confident that I know better than most how to choose the safest and most appropriate lens size for each case. So it's not just the long-standing know-how and accumulated experience with sizing. What's also critical is how accurately you correct nearsightedness and astigmatism. We at Zeratori have our own nomogram that determines the ideal axis and diopter for correcting astigmatism with ICLs to achieve optimal results. But even with a nomogram, what really matters is executing it precisely. That's why we double-check, even triple-check everything. We use both analog and digital axis marking methods. At our clinic, we have advanced digital systems like Catalyst and Varian. Because we validate everything multiple times, we can ensure the ICL is placed at the most accurate axis more precisely than anywhere else. All of these accumulated techniques and systems work together to deliver the best outcomes, and we take great pride in that. One undeniable trend is that when comparing corneal surgeries and lens implantation surgeries, the long-term trajectory of lens implantation is steadily on the rise. This is part of a major, unstoppable wave in the field. Even now, the effectiveness and safety of corneal surgeries are strongly emphasized, especially with the advent of Smile Pro, which delivers even better outcomes. Still, there are clearly patients for whom corneal surgery is not a safe option. And in my opinion, the proportion of such patients is gradually increasing. That's because we live in an era where people are exposed to smartphones, tablets, and computers from a very young age. These factors are actually increasing both the degree of myopia and the prevalence of high myopia over time. So compared to our generation, the next generation is developing worse myopia, and their children are expected to have even more severe cases. From that perspective, it's clear that the proportion and demand for lens implantation are increasing, and we're actually witnessing that trend. This year, lens implantation has increased compared to last year, and next year it will increase even more. So it's not enough to rely solely on corneal surgery to fix everything. You need a clinic that has extensive experience in safely performing lens implantation procedures. It's important to visit a clinic that can not only perform the surgery well but also conduct thorough examinations. Such a clinic should be skilled not only in lens implantation, but also in identifying proper indications for corneal surgery and performing it effectively. If you want to stop wearing glasses or contacts, the clinic that can guide you to the most suitable surgery must be one that has ample experience and know-how in both types of surgeries. That, I believe, is the most accurate and essential message. Thank you.